For more on this new strain of coronavirus, we are joined by Carlos Zambrano. He is an infectious disease specialist from the Loretto Hospital in Chicago. Thank you so much, sir, for joining us. We want to talk about this new variant in the UK. Is it safe to say that this could be circulating here in the United States already?
Hi, Francis. Thanks for having me on. And yes, it could come to the U.S. as well. That variant has more mutations than previous strains, and apparently more infectious. It could be transmitted more easily than the previous strains, but apparently it doesn't cause more severe disease so far. And the other issue is that it may affect children more often than the previous strains.
That is really disturbing news. So what additional measures can England take to try to contain this virus and prevent it from spreading more rapidly? They've already issued some measures already, but is there anything additional they can do beyond that?
I think probably testing is going to be making the difference in containing the spread of that particular strain. There is already travel restrictions all over the world, flights coming in and out of England, but testing is going to be probably the key.
And doctor, as you know, there are variants that are very common among viruses. We see this all the time with the flu, for example. So in terms of this coronavirus pandemic, do you see us having to take more than one shot, perhaps in the near future, do this kind of thing every year as we do with the flu shot, or is it still up in the air right now, given the nature of this virus?
That's a good question, Francis, and we don't know that yet. They're still trying to define exactly if this vaccine is going to cover that particular strain that has mutated, or we're going to need additional strains added to the vaccine. So we don't know that yet, but there are groups studying. The Walter Reed Hospital, the military hospital in DC, is doing that research right now.
And doctor, this variant is more transmissible, it's more infectious, but I've also seen that it's less virulent. So why is that? Can you explain that for us?
Yeah, it seems to be that the viruses, when they mutate and they want to become more spread more easily and faster, they lose virulence and factors and potency. So it happens to all other viruses as well, and especially these coronaviruses. So it could be more infectious, but also over time is going to be less, the disease that they're going to cause is going to be less severe.
So is this going to require more vaccines, different vaccines in the future? Are we likely to see different variants like this emerge in the future, do you think?
Yeah, as you mentioned, it is possible that it could be the newer vaccines are going to look similar to the flu, in which they have more than one strain combining one single shot.
What about this variant, I guess, surprises you or stands out to you the most? What should we be worried about?
I think so far the main difference is it's spreading so fast, and probably 50 to 70% more than the previous strains, and also that is affecting children the most. So as we know, children tend to transmit the disease a lot more than the adults, and because they have a higher viral load. So that would be the only concern, is the transmission is going to be a lot more, so we're going to have to be more careful and follow the public health measures, the keeping distance and wearing the mask and washing our hands better than before.
All right, Dr. Carlos Zambrano, infectious disease specialist from the Loretto Hospital in Chicago. Thank you, sir, for your time today.
No problem. Thank you.